Welcome to CMXP2 InterSect Asia, where bold ideas meet insightful dialogue. Designed for business leaders and board members, the series focuses on today's pertinent topics across several high-regulated sectors in Asia. I'm your host, Hazelyn DeGracia. CMXP2 is a strategy advisory firm with deep sector expertise in marketing and compliance, engagement and advocacy, and sustainability branding. We serve businesses in the high-regulated sectors that include food and nutrition, agriculture and agri-food, life sciences, and global banking and markets. In today's topic, we're discussing healthcare, which affects everybody across the Southeast Asian region. Since the onset of the COVID pandemic, medical costs have skyrocketed, fueled by an already strained system. Governments are under pressure to allocate more resources to healthcare, often grappling with limited budgets and rising demand. In this episode, we'll discuss medical inflation in Southeast Asia, which is posing a difficult problem that requires urgent and innovative solutions to ensure fair patient access to quality care. Joining me here is Mr. Dennis Susay, Senior Partner at CMXP2. Dennis has more than 25 years of deep sector expertise, advocating for clients operating in the life sciences and global banking and markets. Welcome to the show, Dennis.
Hey, great to be here, Hayes. Thanks a lot.
So tell us, Dennis, what exactly does medical inflation mean, and how does it impact the wider region?
I think the most important part here is that the Southeast Asia region is facing really steep medical rising costs since 2021, and it's double digit across the region, anywhere from 10 to 12% all the way up to about 21% year on year. And that's very, very disturbing. So medical inflation usually is measured by medical trend costs. So data from all the insurers, Mercer and Marsh, they expect that they peg the annual inflation to go up a further 3 years for another 3 years. So it's really difficult. So let me put this into perspective. It kind of means that if you went for a surgical procedure in 2020 and it cost about $10,000 in 2020, in 2025, if you go back for that same procedure, all things remaining equal, it'll probably be close to nearly $17,000 to $18,000. And so that's a significant price hike. Now, why is that important? It impacts everyone. It impacts governments because they're funding it. It impacts private insurers because they are payors, insurance companies. It impacts the healthcare providers like hospitals and clinics. And it also impacts patients and their family, as well as society. So the last impact is upon life sciences companies. So they bring in a lot of tests, therapies, treatments that are really important to delivering better quality healthcare. So this medical inflation that the region is facing is a really major force in terms of social, political, and economic. I just want to break this down a little bit. So what's the impact if you're a patient or a healthcare provider, or you just care about someone who is going through a medical issue? High inflation affects the entire healthcare system, the path to diagnosis, the path to treatment, the path to recovery, and the path to outpatient care. So whenever there's high medical inflation and the budgets are running out, patients are always at the end of that. A lot of the treatments that they need, if it's kind of advanced treatment and if it's expensive, it may not be available. So long-term impact is pretty interesting. The whole idea about precision testing, precision treatments, precision medicine, and advanced therapies, they're all under severe scrutiny. So governments right now, the big impact, they're really revising and scrutinizing all forms of costs, and they're changing the healthcare funding model. So that's going to have a massive impact.
Wow, that's pretty concerning. So will the rising costs continue?
Yeah, I mean, the short answer to that is yes. All the insurers expect, I think about 77, 78 in Mercer and Marsh % expect medical inflation costs to rise some more. So it's going to be double-digit growth again for the countries. Now, Indonesia is particularly interesting. Philippines too, both of them are white-hot medical inflation rates. Nikkei Asia in early January 2025 released a report that said that the Indonesian government healthcare budgets faced a massive deficit of $1.2 billion in 2024. And in 2025, medical trend costs for Indonesia is expected to rise 19 to 21%. And it's going to go on to 2028. So Philippines is also white hot. So, this trend of medical inflation costs, it's rising and it's really causing a big strain on governments and payers.
But what exactly is driving medical inflation across the region and why?
Very high level, you're looking at, demographics. Across the region, there is aging populations everywhere. Singapore, Malaysia, Thailand, Indonesia. Yes, Singapore is far ahead of the game in terms of aging population, but aging is definitely one. So as the people get older, you have much more complications. People are living longer too. People are, living like 78 and 85 years old, and some are hitting 90. So, with aging comes a lot of non-communicable diseases. Now, you also have wealth, growing affluence. And one of the big issues is non-communicable diseases such as blood pressure, overweight, diabetes, cardiac issues, end-stage renal failure, dialysis. So those issues, lifestyle related, also are kicking in. So the caseloads for non-communicable diseases, particularly on the cardio side, is really getting bigger. Now, when it comes to cancer, cancer is rising too across Southeast Asia and globally, particularly with women and younger women. And anyone who knows healthcare knows that cancer is so expensive. And with the treatments, advanced treatments for cancer, that's exorbitantly expensive. Those are the big drivers that are driving sort of the increase in cost. Now, one of the other increase in cost is really about medical innovation. So when precision testing comes in, precision treatments, advanced therapies start coming in, everyone in the sector knows that one of the biggest drivers of medical inflation is medical innovation.
Let's go to the big question, right? What are governments and insurers doing to rein in these rising costs?
They are meticulously looking at reducing the cost through a variety of ways. And it's not great because healthcare budgets are usually pegged to the GDPs of each government. Like in Singapore and, certain countries, they try to peg it at about 3.5% of the GDP spend. So it's always a bit of a fixed ratio. So governments are reducing costs and expenses. So we're not really talking just about cost containment, but they are managing down the costs. Again, remember the scenario that it's double-digit year on year since 2021. Right? Some are trying to promote better health programs, better nutrition, better wellness, focusing on the right nutrition value, the right exercise. So I think that's really what they're trying to do. Some governments are promoting, sort of early health screening, but not all across Southeast Asia. Southeast Asia is very different, very varied. What all the governments are doing is looking at some form of value-based healthcare. And value-based healthcare is pretty well accepted in the US, in Japan, in China. Malaysia, Thailand has their own version of it. Malaysia is looking at it right now. Singapore also has some strategy around value-based delivery for healthcare. So all of that's happening around the region. So everyone is looking at value-based care primarily to reduce wastage and increase efficiency and save dollars. So that's what they're doing. Now, if you're an insurer, one of the most important things that insurers are doing, and insurers are usually private insurers, so they're there for commercial reasons. They are there to be able to make sure that the health insurance that they underwrite turns a profit. Now, in talking to the health insurance community, a lot of them are not turning a profit. So they are trimming their coverage. They want to raise premiums, but they are under some scrutiny from the government, but they're definitely trimming coverage. So what you thought was 100 meters wide and 200 meters deep in terms of your previous healthcare insurance package, you need to go back and reread that because it may not be 100 meters wide and 200 meters deep anymore. It's been trimmed down. So the biggest hit is whether or not patients will be eligible for the right access to the therapies, or do they have to self-fund those therapies?
Okay, so why the focus on breakthrough innovative medical treatments?
I think breakthrough medical treatments are really expensive. They are a major cost driver. Precision medicine, precision test, precision treatments, advanced therapies, they are all associated with a higher cost in terms of just the ability to deliver. So the scrutiny is on that space. And so what that means is in many of the markets, advanced treatments may be available, but it may not be available through the public sector, or it may be available through the public sector, but your specialist or oncologist may actually put down his file and ask you, do you have, sufficient funds or private insurance to complement the existing universal coverage so that the patient can actually fund that treatment.
What can life sciences companies do exactly?
I think in this environment of cost cutting and cost reduction and managing down, life sciences companies across Asia, especially in Southeast Asia, are under severe stress when introducing new therapies. I think the most important piece here is that life sciences companies know that Southeast Asia is a very diverse market. So you have Singapore at the upper income bracket.
Yeah.
Singapore, the government in Singapore typically spends about $5,700 per patient. And that's reported in the OECD annual reports. When you look at Malaysia, it comes down to about $1,800. So it varies. And then if you look at Philippines and Thailand and Indonesia, it falls even below $1,000. So, life sciences companies need to be aware of that. What can they do about bringing innovative therapies to market that are expensive in this value-based model? I think they have a traditional model, which really what they call market access. And in market access, what that means is traditionally life sciences companies, whether you're a pharmaceutical company, a biotech company, or a medical device company, what that means is I'm going to get product registered. I'm going to get clinicians to adopt it. And then I'm going to go to the insurers and government to get that listed. And so that helps with the adoption of that technology, of that medical innovation. So that's the past. So that's what you call market access. That still exists today. But the issue about market access is that it needs to be reframed to a value-based model. So what we are calling it value materiality, which is value to the relevant stakeholders plus the use of real-world data. Data from the US or an English hospital is not going to cut it. The industry needs to have requirements that really factor in direct and indirect costs and make it relevant in terms of analysis to each stakeholder. So they really have to grasp this concept. Life sciences companies need to really reframe how they approach market access and look at what we call value materiality for each stakeholder group.
And for the life sciences companies that are looking to launch breakthrough innovations in Southeast Asia, how should they approach it with value-based healthcare?
So I talked a little bit about value materiality.
Yeah.
So there are generally methodologically 3 phases. The first phase is what we call the CFA phase, which is really to contextualize, frame, and appraise all the direct and indirect costs and benefits of the condition, of the disease, of the treatment versus current and existing treatments. So they really need to really have a good grasp to be able to contextualize, frame, and appraise. Now that's really important, and it needs to have really good data, and it needs to be assured. Then after they get the contextualize, frame, and appraise, we go into a second phase of the methodology, which is basically value add and value state, where based on the cost benefit analysis for each stakeholder group, can the life sciences company value add that particular innovative therapy to the system? So, stakeholders could be hospitals, specialists, it could be patients, it could be payers. So can the life sciences company, beyond that particular treatment, value add? And then can they meaningfully value state it? Now, that's all great, but they need to be able to represent that, package it, and then get the right representation to go see multiple stakeholders. Now, once that's ready, then we call phase 3. They kind of move into a phase 3 where they do policy advocacy, where you take that and actually then you go out and you start to advocate for policy change. That's a trick. That's a skill. So, you have to be able to play the long game, because a lot of times when it comes to innovative and breakthrough treatments, the current policies, the current treatment protocols needs to be revisited and rewritten. So it's really quite a reframe. And I think that's what life sciences companies need to do to approach delivering and creating meaningful value.
Can you cite some examples that would help our audience?
I think, maybe we look in the world of precision testing. Cambridge University very recently announced a prostate cancer biomarker test. And it's really interesting because it's a biomarker test that they cited as not being invasive. And one of the things they highlighted when they talked about that biomarker test for prostate cancer, they specifically cited it was a 96 or 99% accuracy. And more importantly, it didn't require an MRI. So if you're a prostate cancer, you're being tested for prostate cancer, you would traditionally need to go for an MRI. So if you know what an MRI is, it's a huge machine, very expensive to run, fully booked in most hospitals. And one of the reasons why it's fully booked is because a lot of patients don't lie still in MRI machines. So there's a lot of downtime, a lot of wastage. So, so that prostate cancer biomarker test from University of Cambridge is just a great example. Another example I can think of is precision treatment. So first one was precision testing, precision treatment. There's a great company that does sound wave blasting called IVL for clogged arteries. So what it does is basically instead of an angio and invasive treatment, they basically target your clogged arteries and sound blast the calcium in it, the calcification in it. Okay. And the calcification is, I think, as thick as an eggshell. So what that does is actually, it's cited that is so accurate and so effective, and it causes less risk and less damage, and it's an easier procedure for the entire cardiovascular surgical crew, that it actually is so much better. So you can imagine that if you're a patient, your hospital is much more effective, it's less risky, there's less complications, you get discharged faster, you have a lesser bill. So that's really great. Let's look at another example, vaccines. In the world of vaccines, everyone knows a vaccine is there to preventive. So, prevention is way better than trying to treat a condition when you get it. So I think vaccines are just a great example. The last one is we call GLP-1. GLP-1s, you could see a lot of media hype around it. A lot, big pharmaceutical companies are driving that just to manage down the obesity. And the reason why they want to manage down obesity and why it's insurance covers it is because if you don't manage down the obesity, the cardiovascular, the diabetes, the heart, the blood pressure, the end-stage renal failure, the kidney dialysis that you need, that goes into the hundreds of thousands of dollars for each patient over a 5-10 years. So all these are just examples of how innovative therapies are really sort of, helping drive the social economic benefits. So that's what we mean by value-based healthcare.
Yeah, it's crucial to strike a balance between maintaining high quality care and cost effectiveness. So before we wrap up, what's the bottom line for life science companies?
Bottom line is that across Southeast Asia, life sciences companies need to really change the game and approach. Now, the bigger life sciences companies, I think they're well-staffed and they have the right funding and expertise behind it. But if you look at the medium to smaller type life sciences companies, they do not have those kind of resources and expertise. So these are very challenging times for these companies to bring that in. So they have to have the right skill set, the right strategy, and the right longevity. I say longevity because in a lot of these companies, turnover is usually between 3 to 5 years. So in driving a policy and advocacy program for policy change, you're driving your value base. These things take anywhere from 3, 5, 7 years. So longevity is really important. The last thing I would say is that life sciences companies need to really think about value creation and value adding. They have the methodology that I talked about, but it's really important for them to realize this and not just keep saying market access is our strategy. Market access is not a strategy, it is a outcome. So they need the right strategy. Tough times for life sciences companies, Hayes.
Yes, indeed. So with that, we have come to the end of this episode. A big thank you once again to Mr. Dennis Susay for sharing his expertise and insights with us. If you enjoyed this episode of CMXP2 Intersect, be sure to subscribe, leave a comment, and share it with your network. Follow us on LinkedIn and X at CMXP2 for updates and upcoming episodes. Till then, I'm Hazelyn DeGracia, signing off.